Hello. Thank you for joining us today. You're likely joining this webinar because you or a loved one is nearing Medicare eligibility or are currently Medicare eligible. As I am sure you have heard or experienced, Medicare can be confusing, and if you were to choose the wrong plan, it could result in unnecessary out-of-pocket costs. We would like to take the time to explain what Original Medicare is and go over all the types of plan options that may be available to you. At the end of this video, you will be provided with additional contact information so that you can request a free personalized review of your healthcare needs and receive information about your exclusive IAMAW Group Retiree Medicare plan. This presentation was created by Employee Benefit Systems, EBS, and TLC Insurance Group in partnership with the IAMAW Union. EBS and TLC Insurance Group partnered together to help service all IAMAW Medicare-eligible retirees, their spouses, surviving spouses, and any Medicare-eligible dependents. This Medicare 101 video is for educational purposes only and is general in nature. Okay, so let's get started by reviewing what Original Medicare is. Medicare is the federal health insurance program for individuals who are 65 or older, those under 65 with disabilities, and for people with end-stage renal disease or ALS. Medicare is funded in part by the taxes you pay while working. Now, let's look at who is eligible for Medicare. You must be a U.S. citizen or a legal resident to qualify for Medicare. Legal residents must live in the U.S. for at least 5 consecutive years, including the 5 years just before applying for Medicare. You must also meet one of the following requirements. You must be age 65 or older, younger than 65 with a qualifying disability, or any age with a diagnosis of end-stage renal disease or ALS. If you are 65 or older, you are eligible for Medicare. If you or your spouse worked and paid Social Security taxes for at least 40 quarters or 10 years, and if you are a permanent resident of the U.S. or a legal citizen who has lived in the U.S. for 5 consecutive years. What does Original Medicare Part A and Part B cover? Part A, hospital insurance, covers services like inpatient hospital stays, skilled nursing facility care, hospice care, and some home health care. Part B medical insurance covers physician services, outpatient medical and surgical services, supplies, clinical lab tests, durable medical equipment, and preventive services such as flu shots and mammograms. There are a lot of out-of-pocket costs associated with Original Medicare Parts A and B. Original Medicare was never designed to take care of all of a beneficiary's out-of-pocket cost. Medicare Part A typically has no premium if you have worked at least 40 quarters. As you can see, if you had Original Medicare only, you would have high deductibles and cost sharing when using Original Medicare's Part A benefits. Medicare Part B has a standard monthly premium for most Medicare beneficiaries. The premium may vary for high-income individuals. As you can see, Part B has a one-time annual deductible and additional cost sharing that occurs with this coverage. Original Medicare's cost sharing amounts are subject to change annually and have no out-of-pocket maximum cost sharing limits. Most Medicare beneficiaries have only individual Medicare plans to choose from. Luckily, as part of the IAMAW Union, you also have an additional exclusive group Medicare plan option to supplement Original Medicare and help with these potential out-of-pocket costs. IAMAW retirees, spouses, surviving spouses, and their Medicare-eligible dependents are all eligible. Original Medicare does not cover prescription medications. Medicare Part D helps with the cost of prescription drugs and is only obtained through private companies. There are 2 ways to obtain this coverage. You can purchase a standalone prescription drug plan, or you can elect to receive prescription benefits through a Medicare Advantage plan that includes prescription drug coverage. Prescription drug coverage has tiered formularies. Drugs are grouped into tiers based on cost. In general, the lower the drug tier, the lower the cost of that prescription. Plans may also include deductibles that are specific to the plan's prescription benefits. Deductibles may be charged for some tiers and not others. So when choosing a plan, be sure to review what the plan's prescription deductible is and what tier it applies to. The cost of your Medicare Part D covered drugs may change throughout the year. If you notice that prices have changed, it may be because you are in a different phase of Medicare's Part D coverage. There are 4 different phases or periods of Part D coverage. Phase 1 is the deductible period. Until you meet your Part D deductible, you will pay the full negotiated price for your covered prescription drugs. Once you have met the deductible, the plan will begin to cover the cost of your drugs. While deductibles can vary from plan to plan, no plan's deductible can be higher than the Medicare standard amount, and some plans have no deductible. Phase 2 is the initial coverage period. After you meet your deductible, your plan will help pay for your covered prescription drugs. Your plan will pay some of the cost, and you will pay a copayment or coinsurance. How long you stay in the initial coverage period depends on your drug cost and your plan's benefit structure. For most plans, the initial coverage period ends after you have met the specified Medicare threshold in total drug cost. Your total drug cost includes the amount you and your plan have paid for your covered drugs. Phase 3 is the coverage gap. After your total drug costs reach the Medicare specified amount, you enter the coverage gap, also known as the donut hole. The donut hole closed for all drugs in 2020, meaning that when you enter the coverage gap, you will be responsible for 25% of the cost of your drugs. In the past, you were responsible for a higher percentage of the cost of your drugs. Although the donut hole is closed, you may still see a difference in cost between the initial coverage period and the donut hole. For example, if a drug's total cost is $100 and you pay your plan's $20 copay during the initial coverage period, you will be responsible for paying $25 or 25% of $100 during the coverage gap. The final phase is the catastrophic coverage period. In all Part D plans, after you have met the coverage gap limit in out-of-pocket cost for covered drugs, you will reach the catastrophic coverage period. This amount is just the amount you have paid, not the total drug cost that you and your plan have paid. During this period, you pay significantly lower copays or coinsurance for your covered drugs for the remainder of the calendar year. The out-of-pocket costs that help you reach catastrophic coverage include your deductible, what you paid during the initial coverage period, almost the full cost of brand name drugs purchased during the coverage gap, amounts paid by others on your behalf, and amounts paid by state pharmaceutical assistance programs. Costs that do not help you reach catastrophic coverage include monthly premiums, the cost of non-covered drugs, the cost of covered drugs from pharmacies outside your plan's network, and the generic discount savings. During catastrophic coverage, you will only pay 5% of the cost for each of your drugs, or $3.60 for generics and $8.95 for brand name drugs, whichever is greater. Your Part D plan should keep track of how much money you have spent out of pocket for covered drugs and your progression through the coverage periods, and this information should appear in your monthly statements. Let's review the premium cost and potential premium adjustments on original Medicare. For Medicare Part A, you usually are not required to pay a monthly premium for coverage if you or your spouse paid Medicare taxes for a certain amount of time while working. This is sometimes called premium-free Part A. For Medicare Part B, the average monthly premium is determined annually. This premium may be higher for individuals with higher annual incomes. Medicare Part D may be attained through Medicare Advantage or Part D plans. The premiums depend on the plan. This premium may be higher for individuals with higher annual incomes. Social Security calculates the exact amount you will pay for Part B. Social Security also calculates any additional premium amount you may have to pay for Part D based on your income. This is assessed annually with a 2-year look-back on your IRS tax filing. If you delay your enrollment into Original Medicare or Part D, you may be required to pay a penalty in addition to your premiums. The late enrollment penalty would be applied for as long as you are enrolled in the coverage. On Medicare Part A, there is no late enrollment penalty if qualified for premium-free coverage. Otherwise, there could be a 10% penalty. On Medicare Part B, there is no late enrollment penalty if qualified for a special enrollment period. If you delay enrollment without creditable coverage, you could be assessed a 10% penalty for each full 12-month period not enrolled. On Medicare Part D, there is no late enrollment penalty if less than 63 days without creditable coverage. Otherwise, the penalty for late enrollment would be 1% of the current average premium for each month. Once eligible for Medicare, you will have options to choose more coverage to protect you from the high deductibles and cost sharing of Original Medicare. You can choose between a Medicare Supplement and standalone Part D plan or a Part C Medicare Advantage plan. We will cover these options on the next few slides. Part C Medicare Advantage plans are a type of Medicare health plan that are offered by private insurance companies. Medicare Advantage plans cover all the benefits of Original Medicare Part A and Part B. Plan members are still in the Medicare program. Most Medicare Advantage plans offer prescription drug coverage. Medicare Advantage plans may offer additional benefits such as dental exams, cleanings and x-rays, eye exams, hearing tests, fitness memberships, and wellness programs. Now let's go over some of the types of networks on Medicare Advantage plans. An HMO is a health maintenance organization. With HMOs, you can only go to physicians and healthcare facilities within the plan's network, except in an urgent or emergency type situation. If you would use out-of-network providers or services, you could be responsible for all of the out-of-pocket costs associated. On HMOs, you may also need to get a referral from your primary care doctor to see a specialist. A PPO is a preferred provider organization. PPO plans allow members to use in or out-of-network providers. On a standard PPO, you will pay less if you use physicians and healthcare facilities that belong to the plan's network. You usually pay more if you receive services outside of the plan's network. Your exclusive IAMAW group plan is a passive PPO plan. Members of the IAMAW group plan may go to any provider that accepts Medicare and agrees to Humana's terms and conditions. Your IAMAW group plan also has the same coverage and benefits, whether you use in or out-of-network providers. Let's briefly touch on what a Medicare supplement is. Medicare supplement plans, also known as Medigap plans, are offered through private insurance companies. These plans help pay some of the hospital and medical costs that Original Medicare doesn't cover, such as co-payments, co-insurance, yearly deductibles, and health care if you travel outside of the U.S. You must have Medicare Part A and Part B to purchase a Medicare supplement. Once enrolled in the plan, you must continue to pay the Part B premium, in addition to your Medicare supplement premium. Medicare supplement plans can only be paired with Original Medicare and a standalone prescription drug plan. You're probably wondering, what's the difference between a Medicare supplement and a Medicare Advantage plan? Well, let's compare. Let's start by comparing the coverage. A Medicare supplement plan pays some of the costs not paid by Original Medicare and has nationwide coverage. Medicare supplements do not help with drug costs. A Medicare Advantage plan provides benefits of Original Medicare and beyond, and often does include drug coverage. Medicare Advantage plans may include a provider network. When comparing the two options, a Medicare supplement plan has a monthly plan premium. It also could have an additional drug plan premium and other costs or copays if prescription drug coverage is added. Medicare supplement out-of-pocket costs depend on the plan chosen. A Medicare Advantage plan may charge plan premiums, but generally, the premiums are lower than Medicare supplements. Medicare Advantage plans may require copays or coinsurance for most covered services. Enrollment into a Medicare supplement along with a standalone prescription drug plan, would require two plan enrollments and you would be issued two separate insurance ID cards. One ID card would be used for medical services and one card would be used for prescription services. Conversely, a Medicare Advantage plan is an all-in-one plan. Most Medicare Advantage plans include medical and prescription benefits in one convenient plan. One insurance ID card is used for all medical and prescription services. When can you enroll? In the next few slides, we will cover the different enrollment periods for Medicare-eligible beneficiaries. During Medicare's initial enrollment period, you will be enrolled in Medicare Part A and Part B automatically. If you are receiving your Social Security or Railroad Retirement Board benefits at age 65, or after receiving Social Security disability benefits for 24 months. You may also enroll yourself into Original Medicare if not receiving benefits already. You can enroll by visiting ssa.gov or at your local Social Security office. You should enroll early to avoid gaps in coverage and late enrollment penalties. You may refuse or delay enrollment in Part B. For example, you may want to do this if you are still working and have employer coverage. During this initial enrollment period, you may enroll in a Medicare Advantage or prescription drug plan. It is important to understand what the Medicare Advantage annual enrollment period is. It occurs annually from October 15th through December 7th. During this time, Medicare-eligible beneficiaries can switch from Original Medicare to a Medicare Advantage plan or vice versa. Medicare-eligible beneficiaries may also switch from one Medicare Advantage plan to another, or join, switch, or drop a Medicare prescription drug plan. Plan benefits may change annually. It is recommended that members review their current coverage during this time. The enrollment period from January 1st through March 31st is called the Medicare Advantage Open Enrollment Period. This is available to Medicare Advantage plan members only. Just one coverage change is allowed. You may switch to a different Medicare Advantage plan or return to Original Medicare and enroll in a Part D. Thank you for taking the time to learn about Original Medicare today. We understand that Medicare can be confusing and that you may still have individual questions. There is an additional short video that overviews the IAMAW Group Medicare plan offered by Humana. We encourage you to watch that video to learn more about your exclusive group plan benefits. If you would like your free personalized review of your exclusive IAMAW Group Medicare plan, please call Humana's Group Enrollment Department toll-free at 1-800-833-2411. That's 1-800-833-2411.